Hi everyone, in this video we are going to discuss about porcelain fused to metal versus zirconia crowns. So let's look at some of the preparation design of the porcelain fused to metal crown. So this is a typical crown preparation which I did during my master's training, and in this prep it's a typical prep where we have prepared buccal area for porcelain fused to metal, and palatally it's just metal, and that's why you see this beautiful wings or a step between buccal and palatal junction, where you have made a junction between 0.5 millimeter to 0.8 millimeter reduction versus 1.3 to 1.5 millimeter reduction. So this one shows that you need 1.3 to 1.5 millimeter reduction for porcelain fused to metal crown, because you need reduction for metal on buccally. You need reduction for thickness of the opaquer to block that metal, and you need space for porcelain on top. If you want really good aesthetic result, then you need more space. And that's why porcelain fused to metal crowns are more invasive than all ceramic crown which is done in zirconia. Having said that, we have long-term study of porcelain fused to metal crowns, and their longevity and their success rate is much higher, at least from the studies we know, because the zirconia crowns haven't been used as long as the porcelain fused to metal crowns have been used. So when I'm preparing these teeth, there are a few things I am considering. First thing I'm considering is, can I get away with metal surface? Now you need to discuss this with patient, because some patient do not like having metal at the back. When they tilt their head forward or backwards, people can see the metal, and some people don't like it. So you need to make sure that you have this communication with patient. But if they can have metal and this is canine, then I can give really nice guidance on that tooth, and I'm more than happy to do that in this type of teeth where I've got really nice tooth tissue. However, if patient has a porcelain on this tooth, although we have studies showing that porcelain is polished porcelain, the wear rate of the opposing tooth is almost same as a metal crown, I feel comfortable if I'm doing porcelain crown then to share my guidance. So this is, again, you need to consider whether you're going to cover palatal surface with the metal, or you're going to do all porcelain fused to metal crown everywhere, because that will dictate how much reduction you are doing. You also need to consider your junction palatally between porcelain and the metal. Now this is the same concept we used in my previous video where we're doing veneer preparations, that you need to make sure that junction between porcelain and metal in your crown is not at the level where the tooth is contacting. So you need to make sure that you communicate with with the technician, and technician will know this from your preparation, because where you need porcelain you would have prepared more, and where you need where you just need metal, you would have prepared less palatally on the palatal surface. And you can see in the second picture where there is tooth preparation and where there is a red arrow, that's where the junction is, because technician would know that I have prepared more palatally, more incisely than palatal area. Obviously I would let technician know in my lab docket, and I would advise technician that I have prepared in such a manner that they understand where the junction needs to be. If you are guiding, or if you're using that tooth for guidance, then you need to make sure that you mount model on an articulator, and that will help you in giving a better chance or better accurate result when you are cementing that crown. Now the other option is zirconia crown or all ceramic crown, which could be Emax crown or another ceramic material. Having said that, the zirconia crown, you will get away with the most thinner preparation than any other porcelain crown, although it will depend on the technician and their capability, how thin margin you can get away with when you're using zirconia crowns. You do need to understand that zirconia imbibes, which means they absorb water, and in a long run there is a chance that they can fracture. And we have seen this in bigger frameworks when we're doing implant restoration with zirconia or bigger bridges, that there is a chance that the zirconia can fracture. The other issue with zirconia is there is still issue of debonding of layered porcelain. So zirconia, when you are telling your technician that I would like zirconia crown, you need to tell technician what type of zirconia crown would you need. Would you like to use monolithic or layered zirconia? Because they need to know that they have some space for layering or not. When you say layered zirconia, which is most likely feldspathic porcelain on top of zirconia, and there is again risk of that feldspathic porcelain chipping from zirconia if it's not been treated properly. Using zirconia is a very technique sensitive because it's very heat sensitive. If you heat zirconia during polishing and finishing process a lot, you can then start crack propagation, and then zirconia starts cracking. So 3 tips for this is, if you're preparing teeth for PFM, then make sure you have done enough reduction. Otherwise you will start seeing this opaqueness, because technician will need metal and technician will need opaquer, because they need to opaque the metal to make sure that the metal is marked. So these 2 things needs to be there, must. Now the rest of the space is filled with porcelain. Now if there is no enough space, then technician will put very little porcelain there, and then the opaquer will show through the porcelain. And that's why sometimes you see this porcelain fused to metal crown very, very opaque. That's because there is not enough reduction. Or technician has made too thicker core of the metal, and then he lost the space which you created. So ideally, when people are making PFM crowns, they should be doing full contour wax up, then cut back of the wax, just leaving a thin wax where the metal is, and then casting that metal, and then using porcelain on top, so they know exactly the thickness of the metal and in relation to the final outcome of the shape. Consider gold as a metal substructure, because if you have a gold, then masking of that metal becomes a little bit easier than having non-precious metal. And advise technician, when you prescribe zirconia, whether you want monolithic zirconia or you want layered zirconia, because that will depend on whether technician's putting some layer on zirconia or not. If I'm doing central incisor and if I am doing zirconia crown, then I would ask technician to do layered zirconia to get a better aesthetic result. But if I am doing molar and if I'm using zirconia crown, then I would like technician to do monolithic zirconia. That means I don't need to reduce too much tooth in order to create space for that layered feldspathic porcelain. So I can get away with reducing less amount of tooth, and I have still solid block of zirconia which is stronger. So I hope you found this video useful. If you have, please share with your colleagues or friends. If you have any questions, contact me on social media or go to my website www.drdevangpatel.com. In the next video, we are going to discuss about cementing versus bonding your restoration.